So Jen, boy, we have some history, don't we?
We sure
Right.
do.
2018, you came
I
into
believe
us.
so.
You were in a wheelchair.
Correct.
Then you came in for the 7-month follow-up. You were in a walker.
That's right.
And the next 7-month follow-up, you were walking on your own. I think you got a job as like a waitress back then or
That's
something
correct.
like that.
Yeah.
Carrying trays from being in a wheelchair.
Yeah.
Don't tell me that cannabis isn't amazing, right?
It's incredible.
Yeah. So, how have you been?
Just really, really good.
Yeah.
Everything's been getting, just better and better. You
Yeah.
know, every day seems, it still can be a struggle, but I'm doing really, really well
Right.
ever since starting with cannabis. It's impacted my life in so many different ways. I'm happier. I sleep better. The pain is definitely less.
Good.
For sure.
Awesome.
Yeah.
Awesome. So we were talking before we got on camera about the rule, the emergency rule that went
Right.
into place back in August of 2022. A lot of patients didn't realize it because there's a rolling allotment over
Sure.
70 days, and basically the state is restricting the amount of milligrams of THC a patient can access. I remember from back in the day, you always had a higher tolerance.
Yeah.
We were talking, you have the redhead gene.
Right.
So you said you were born with red hair.
Correct.
And usually, typically, that's a chromosome, and people with red hair usually have a higher tolerance to THC, to caffeine, to alcohol,
Right.
to pain medication.
So true.
You're a good customer for the dispensary. How has this emergency rule affected you?
So I wasn't able to access enough milligrams to treat my chronic severe pain. I had to turn back to opioid pain medication, and it's just been, I've been off it now for a month roughly, but I had to go back on the pain medication until I was able to figure out that I, could get the exemption.
So I don't know if you can tell, but my blood's boiling right now
Yeah.
because we work so hard together, right? You
Right.
know, and it's unbelievable that somebody made this type of decision on the state side, and you almost wonder if it's funded by big pharma,
Right.
because it's like to push patients like yourself back out
Exactly.
to pharmaceuticals or even to the street.
Right.
I mean, heaven forbid someone goes to the street and buys a fentanyl laced vape cartridge
Right.
now, right? Or luckily you turn the corner, you turn
Yeah.
back around
Yeah.
the corner,
Yeah.
so and now you've got the exemption, so you're able to get the higher milligrams to cater to your needs. But
Exactly.
you're a perfect example of why we need to make these people accountable on the state
Absolutely.
side, because people have had success for 5, 6, 7 years now, and now all of a sudden their regimen is affected, and
Exactly.
it's terrible. Why does somebody have to die or overdose or go back
Exactly.
to the drugs when
Right.
you're making progress? So, but I'm super proud of you.
Thank
It's
you.
Awesome to
I
have you
appreciate
here,
it.
and as you know, we're kind of like family now.
Yeah,
so
we go back a while.
So we'll keep up the great work.
Thank
you
you.
so much for coming in and sharing
Thanks
your
very
story.
much.
All right, perfect.